In Alabama, officials have reported another drop in new COVID infections in schools. Last week, just over 1,900 students tested positive for the virus, and that's down 23% from the week before. Now, when it comes to individual districts, all of the ones listed there on your screen saw their case counts drop as well. Jefferson County schools were the only one to report more than 100 cases this week. And thank you for staying with us. I'm Carla Wade. In moments, State Health Officer Dr. Scott Harris is going to give us an update. And in fact, I think he's ready to speak.
Thanks for you, and then we'll be glad to answer questions. We are seeing some improvement in our numbers. As you know, for the past couple of weeks, we've had declines in our number of cases. Very thankfully, we've had declines in our number of hospitalizations as well. We're down to just over 1,000 inpatients in the state, which is not a great situation, but it's about two-thirds less than we were seeing a month or so ago. We have not really seen a change yet in our number of deaths. Unfortunately, deaths, as you know, are the last number we see to improve because we still have people in the hospital who just haven't been well enough to get out. We right now stand at 14,756 deaths that we have confirmed. We have many more that have been reported to us, so around 15,000 deaths total. I know you've heard the statistic that about 1 in 500 Americans have died from COVID-19 in the past year and a half. In Alabama, that number is about 1 in 330. 1 out of every 330 people in our state has died from COVID-19 since the pandemic began spring a year ago. We do have one good milestone to note. We actually surpassed the 2 million mark this week in terms of numbers of Alabamians who are fully vaccinated. More than 2 million Alabamians now, which is more than half of the eligible population, has been fully vaccinated. We're very happy about that number. That number still lags a lot of the country, however. We have a lot of room for improvement. As of today, we are ahead of about 8 states in terms of people who've gotten at least one shot, ahead of 3 states, I believe, in terms of people who are fully vaccinated. So we still have a lot of room to go, a lot of improvement. We're expecting in the next couple of weeks some pretty significant events. This coming week, we'll see the FDA Advisory Committee meet to talk about booster doses for J&J and also for Moderna. We think that they're going to be meeting this coming next week, this coming Thursday and Friday next week. And so we should know something by the end of the week next week on booster doses for those products. As you know, we are already doing booster doses for Pfizer, but have not had guidance so far on those other 2 products. In a couple of weeks, on October 26th, that same advisory group to FDA called the VRBPAC is going to meet to talk about pediatric COVID vaccinations. They're going to talk about adding the age 5 years through 11 years old group. As you know, there's already approval for age 12 and up, so that would potentially approve or make eligible the 5 through 11 group as well. So we'll know more about that sometimes towards the end of the month. It's certainly very, very possible that we could have a vaccine available for all kids age 5 and up by early November. We think that's very likely, in fact. Just to remind you how the process works, after the FDA makes that decision to authorize a product or to fully approve a product, it then goes to CDC for their advisory group, the ACIP, to review that data, and the CDC to make a full recommendation before we begin endorsing that here in the state. So that process usually overall can be done in as little as about a week or so. So hopefully in the next 10 days or so, we'll know more about booster doses for Pfizer and Moderna.